11:10 a.m., 96.7 FM, News, Talk, and Sports for Maui. Jack is here behind the controls for Talk Story with Mayor Mike Victorino and Communications Director Brian Perry. Hello, guys.
Aloha and good morning to you, sir. And again, we're very blessed today to have a very special guest. We have all these very special guests. You know that. I don't think anybody on the show unless they're a very special guest.
That's right.
Okay, I brought you along because you're very special.
Well, I'm a guest.
You're a DJ.
A guest and a guest.
Yes. Anyhow, and I'll have Brian introduce this young lady.
Okay.
If that's all right with you, Jack.
Sure. Yeah. Brian.
Oh, thank you very much, and good morning, Maui. Our guest today is Dr. Sally Irwin. She is a microbiologist, and your doctorate is in genetics, correct?
Correct.
Dr. Irwin? And you're also an adjunct, is it called like an adjunct professor at the John A. Burns School of Medicine Biology Department, is that right?
Yeah, the Cell and Molecular Biology Department.
Oh, thank you very much. So the reason we asked you here today is that we thought that you could provide some of the background information about science and the science of COVID and vaccines. And as we were preparing for the show yesterday, you were saying that people have certain misconceptions about that. Could you go into that a little bit?
Okay, yeah, there's a lot of misconceptions, but I think a couple of the misconceptions I hear most often, and that I don't think has actually been addressed as much. One is people not really understanding how the vaccines work and why it's important for everybody to get the vaccine. So even if you feel like you're not worried about getting sick or feel like your immune system is strong enough that that you're not worried about yourself, if you end up being a host to the virus, so the virus gets into you even if you're asymptomatic, you're giving the virus a place to replicate, because viruses cannot replicate outside of a host cell. So when the virus gets in you and is able to replicate, then mutations can happen. And this is how we get the variants that we have. So the more hosts that the virus has to go through, the more chance there is for new variants to form. And so then it's just kind of a roll of the dice. Eventually, we end up with these variants, and in some cases we could end up with a variant that the vaccine is no longer useful for. So you're really not just endangering yourself when you don't get vaccinated. You are basically allowing the virus to keep going and potentially end up as a variant that may infect everybody, even if they were sick before, they could get it again because it's a slightly different form of the virus. So your immune system no longer would be able to defend you against it.
What is the misconception of vaccines, and can you help correct that?
Well, again, I think there's a lot of different misconceptions on vaccines, but maybe one of the big ones is that I think a lot of people think of it as a drug almost, like you're being given a drug to prevent the illness. But really what you're being given is kind of an alert to your immune system. It's just kind of giving a little part of the virus to your immune system so that your immune system has a chance to mount a defense against the whole virus in case you ever come across it. So the vaccine itself is not the virus, it's just information from the virus that tells the immune system how to mount a defense against it. So if your immune system's strong, that's great, because the vaccine is going to work really well for you, and you're going to mount a defense against the virus in the same way you would if you were infected with the virus itself, or in a very similar way.
So can you explain how the body's immune system works? Because the immune system works not just for this particular virus, it works for all different kinds of illnesses out there. So how does the immune system work naturally? Well,
kind of in a nutshell, because there's a lot to the immune system, but so when you are infected or are vaccinated, either one, with something that your body has never seen before, which when COVID came in, basically humankind had never seen this virus before, so everybody was susceptible to it. And so when your body is exposed to something it hasn't seen before, so it sees it as foreign, then there's two parts of your immune system that will react. There's the antibodies, which are your B cells, and they are going to form, like what everybody's been talking about, your antibodies that are going to hunt down this foreign body. We'll just talk about the virus. We'll hunt down the virus and basically identify it for other parts of the immune system to destroy it. And so once it knows what it is, it can make these antibodies that are very specific for that virus and basically kind of put a little flag on the virus that tells other parts of the immune system, hey, this is what we need to get rid of. And so then there's other parts of your, like white blood cells and stuff, that will come and destroy it. And that's for anything that's circulating in your bodily fluids. If you have the infection inside your cells, so the virus actually gets into your cells, then the antibodies aren't the ones taking over. And then it's the T cells, it's the other part of your adaptive immune system that will look for the infected cells and then will destroy those infected cells. So it's kind of like we have one part of our immune system patrolling the, like your blood and your lymph system, and then the T cells that will look for cells that are already infected and just go to destroy them. And that's something hasn't been talked about too much with the vaccine, is that the vaccine, especially the mRNA vaccines, seem to be getting a really good response from both antibodies and T cells that give you a long-term defense against the virus. So we know the antibodies go down after a few months, like we've been talking about breakthrough infections and do we need a booster. We know the antibodies go down, but that's also normal. The antibodies will go down after a certain time because there's nothing there to defend. You don't need to have them, but you will have memory cells that will be there waiting in case something comes up, so they can make a bunch more, if needed. But the T cells are also really important, and those so far don't seem to be going, changing so much. But there's still, I keep telling people we're kind of flying the plane and fixing it at the same time. I mean, we can't know some of these things until there's more time, so we have to kind of err on the side of caution in that, like getting booster shots can be, preventative, as we see the immune system maybe starting to wane, or because of the, things like the variants that, where you can get these breakthrough infections.
Dr. Irwin, I've listened to you very intently. Amazing what you shared with us. Thank you very much. The question I have for you is, has any time in history we've seen the world go from not having any protection for a particular virus to now having multiple vaccinations that help, and it's been proven, I should say, that the vaccine helps reduce severe illness, hospitalization, and even death. I mean, if anything, those are the three reasons I would recommend anybody, right, Dr. Irwin?
Oh, absolutely, and yes, there's lots of examples. I mean, we can go back to smallpox, and polio and measles, and there's all the normal childhood vaccinations that we get. I mean, these diseases, the evidence, the data is so clear, the impact that these vaccines had on all of those illnesses, that we don't really worry about them anymore. At least in the developed world, some of the diseases are so worse in other places, but yeah, the vaccines have done their job. Smallpox we've eradicated, it's gone.
And so this is why those who oppose it, or those who have these misconceptions of the vaccine, really put themselves at tremendous risk, if I'm correct in saying that.
Yeah, I mean, if you can prevent something from happening, if you can prevent an illness by basically priming your immune system ahead of time, giving it a heads up as to what's out there, taking the chance of getting the infection and possibly getting very sick or spreading it to other people, even if you don't get that sick, and people dying from it, it just doesn't make sense.
Okay, Brian, go ahead. I'm sorry, Brian.
Dr. Irwin, so early last week the FDA approved the Pfizer vaccine for those 16 years and older, and for 12 to 15 it's still in an emergency mode. What I was wondering about that is that, some people have said that there hasn't been enough testing of the vaccine for them to feel confident about using it. What is your view about the amount of, first of all, is the vaccine that we have safe and effective? And then do you think that enough testing has occurred in order to give the public a confidence that it's safe?
Yeah, I think at this point, the number of vaccines that have been administered worldwide are somewhere in the millions.
Couple, 200 million or something.
Yeah, it's a huge number.
Yes, that's probably even bigger than that.
And the number of really severe adverse effects are almost nothing. Literally, I'd have to look up again. I haven't looked it up real recently, but the last time I did, it was I think less than 1%. It was a very small number. So yeah, we always have to look at risk versus benefits in any type of medicine, any type of medical procedure or drug, and this is just pretty overwhelmingly positive. The benefits far outweigh the risks. So yeah, I would say it's definitely well tested and safe. Yeah.
Can you just talk about science in general? There seems to be among some in the community just some skepticism about science itself, and you're a scientist, and have you seen that, and what do you think of that?
Yeah, I feel like there's been a real shift in the last 10, 12 years where I feel like the trust of the scientific community and of science in general has waned, and I think a lot of this has to do with social media, just like a lot of other things. There's so much misinformation that goes out onto social media, and it's so widespread that I think this is what a lot of people are listening to and thinking about, and they don't really understand the process of science. And the process of science has more checks and balances than anything else that I can think of. If you are a scientist and you are found to be fraudulent in any way, if you're trying to falsify data in any way, you're done. You could be at the top of your game, and they find out you falsified any data intentionally, you're done. No other scientist is going to trust you, and nobody else is going to trust you. And I think a lot of other professions you can get away with a few of those and still stay in, but in science you can't, and everybody's always checking each other. So with peer-reviewed science, and I think that's what's important, is a lot of people don't know how to look for what is peer-reviewed science, what is science that you can trust, because sometimes people put things out that sounds like science, but it's really not data-based, it's not peer-reviewed. So if it goes through the peer-reviewed process, then people are checking what you did, and they want to make sure that you went through the proper methods and used controls and all of that to make sure that what you're saying can be substantiated.
So how can you help people, maybe I'll just call them consumers of information, consumers of science, and they go online and they want to know good information about COVID or about whatever? How are they able to discern what is good information as opposed to what's not good information? Okay,
well, there's I actually go through this in my classes to help students to identify what's accurate and something that's that they should trust. There's a website, and I can't tell you exactly the website, but it's called the CRAP test, C-R-A-P. And so that's what people can remember that one pretty well. There's some other ones too, out of like UC Berkeley, but the CRAP test people will remember. So you can go to that and it'll kind of walk you through what to look for. But a lot of it is things like, with the website being if it's .edu or if it's .com or it's .gov. that tells you something about what kind of website you're looking at, and what might be the reason behind the website. Are they trying to teach you something like a .edu? Are they trying to sell you something like oftentimes a .com? Or is it the government, .gov? And so then also look for who is putting this information out. Do they have authority in the field, right? Who are they? What have they done? And then do they have data to support what they're saying? And if so oftentimes you'll have references, in there, and they should have references if they're talking about data, and if those, are those references legitimate? Can you click on them and get to, actual research that they've done? So I think a lot of it, we have to trust, our experts in the field, no matter what field we're looking at. Most of us don't get on a plane and feel like we have to know how it's, how it works, in order to fly on it and feel safe, because we feel like there's people who are doing that. And, I think people thinking that they're going to understand everything about, how vaccines work and with viruses, when people have spent, maybe 12 years in college or more, to get their, Ph.D. or something in it to understand this material, they're not going to be able to explain it to them in 5 minutes. They have to have some trust in these experts, but know who the experts are. Looking at the CDC or the FDA and these people that have, that this is what they do. This is where, what they know and understand.
Well, thank you. And Dr. Irwin, a lot of times people become what I call Monday morning scientists, like Monday morning quarterbacks, right? They know a lot, or they seem to know a lot. You've met them too, Jack.
All the time.
Okay. And so this becomes real difficult, because they'll go out and tell their friends this, and this, or I know this, or I've heard this. And okay, and you trust your friends. Oh, I trust Jack. And you take that as gospel.
Right.
And start spreading it around, which before you know it, and social media is part of this, it gets out there, and it's almost impossible to retract it or to pull it back, because now you've got to defend science, defend what you've done to get to this point over what is being said. And so, as a scientist, as a human being, how do you address this to your friends and family and people around you, your students? I guess that would be my question to you.
I just really, it happens all the time. It happens all the time in classes, where somebody will say, well, I heard, that this happened, or my friend, had this happen. And so then I will start asking the questions like, well, let's say this is from a while back. Maybe, my friend, ate something and then they got sick from this, and so we think, there's a problem with this food possibly. And, but I'd ask, well, what else has your friend eaten? Have they ever eaten that food before? Do you start looking at, what data actually supports what you're saying? Can you give me the data that supports this? And is this information that's recent? Because sometimes I'll have people emailing me or something and wondering about something, and they'll say, well, this is what I heard, and I'll ask them for references, and they'll send me something 15 years ago. And it's like, yeah, 15 years ago, this is the information we had, but now we know that this is not, this is really what's happening. Mm-hmm. And so, yeah, looking at, really have to look and see. It can't just be somebody said this. You have to have some data behind it and understand that, statistically, you have to have statistical significance in what they're saying. If it's one person, or are you looking at 1,000 people?
Do you know if someone had a question about some issue, some science issue, and they wanted to ask someone, is there a website or is there anyone you could recommend that they send their question to try to get an answer?
Are you speaking in particular about COVID, or?
Well, especially about COVID, but just anything in general that science related.
I don't know really of there's a lot of different websites out there, and I think you can usually go to websites like, government, or, what you're looking for really is the bodies of science that are supported by things like USDA and FDA and NSF and NIH, because then you don't have the bias that you might have if it's more supported by a particular business. So you want it to be like a nonprofit type of association that's looking at the problem, and a lot of times they will have things that they can send where they're really just looking at all sides of it and just trying to see what are the facts, what does the data say.
Do you think that because the different vaccines are associated with the pharmaceutical companies and there is that profit element to it, that fuels some of the skepticism in the public?
I think that definitely does, although I know that that the pharmaceutical companies never really liked to work with vaccines, because vaccines traditionally have not been very profitable, because it's you don't really know. I mean, these kinds of things come and go. You don't know when it's coming, how long it's staying. So putting a lot of money into developing vaccines and then possibly having them used or not used, or work or not work, is not generally one of the more profitable ones. So not that that's a great argument, but I think maybe more importantly is that behind the pharmaceutical companies, or before the pharmaceutical companies, any of this is going through basic research, and so that's happening in the nonprofit, in the universities and in the other things like Salk Institute and places like that develop the science behind the vaccines. Pharmaceutical companies take that basic research and then apply it in a product, but there's still checks and balances on that. They can't just put something out and not have other people looking at it for its safety, like the FDA.
Dr. Irwin, I've said many times, and I want, as what I call scientist, to confirm or deny, and maybe you can't, but I've said many times, COVID-19 is here to stay. It's not going to go away. I don't see any way of eradicating it. And the new mutations have really demonstrated how quick, of all the viruses, this virus seems to keep mutating. Now, part of it is mankind and our resistance to do what I say is right. Okay, I'm not saying it's the only way, but it's right. However, I don't see it going away. I mean, I think this is going to be with us for the rest of our lives, and lives from this point forward, like the flu and others that have come, variations of, different strains of, but it's always there. Would you concur with something of that, a statement of that nature?
Yeah, I think like you said, we have influenza, and we've had different versions of influenza. You could go back to the 1918 flu, the great influenza, where 50 million people in the world died. I mean, right now we're up to, what did I look the other day? We're not, like 500,000 people have died, I think, in the world at this point.
I thought the United States had something close to that already. So
yeah, we have 600,000, right? That's what I'm thinking. So worldwide, it's a little,
it's got to be in the millions.
Over a million, but it's nowhere near 50 million, because we've done the masks, we've done the social distancing, and now have the vaccine. They had no vaccine back then.
Yes.
So 50 million people dying worldwide in a much smaller population. If we hadn't done the masking and everything we've done, we would be way higher than what we are right now. But we haven't had that same flu virus back since that time. But like you said, we've had different variations, and I think we will have different variations of COVID. But I think we can, with vaccination, we can definitely eliminate some of these more virulent forms that are causing death and really severe illness, and things like the long hauler symptoms that we're seeing now.
Okay, so we're going to take a break. Would you like to come back and talk a little bit about the long hauler and some other issues, if that's all right with you, Jack?
Absolutely, Mayor.
I got to check with Jack.
Well, I'm being fascinated by it.
Isn't it wonderful?
Yeah, I love it. I love it.
Yeah.
So we'll continue. You're tuned to 1110 AM, 96.7 FM News, Talk, and Sports for Maui. And let's take a break. We'll be right back. You're tuned to 1110 AM, 96.7 FM, News Talk and Sports for Maui. Jack is here behind the controls for Talk Story with Mayor Mike Victorino, Communications Director Brian Perry, and a very special guest here. Well, I feel like I'm finally taking the class that I forgot to take in high school, in the college.
That's right, Jack.
Some facts flying around here that I think are very impressive. And people, I wish people, the rub is what's killing me, where, the doctor here coming up with all these facts, and people still going, yeah, but
but I get really sick with long haul effects, right?
Yeah.
But I do die.
So
there's a lot of but, and so let's talk a little bit, doctor, if you don't mind, today about the long haul effects and mask wearing, because I think mask wearing has been kind of being fought on many fronts by many people who really don't understand the concept. And tell me if I'm wrong. If I wear my mask and you wear your mask, the amount of transmission drops tremendously. If you don't wear yours, it's some percentage. I remember Dr. Pang telling me these percentages, and if I didn't wear my mask and both of us wear my mask, it gets much higher. So let's talk a little bit of masks and some other subject matters that we were talking about during the break.
Yeah, I mean, masks are, I think, one of the simplest, effective ways of preventing the transmission of this virus in particular, because this virus transmits, just through talking and breathing. And it, creates a barrier between you and somebody else. So it is very effective, very easy, very cost-effective as well. And so now we have so many masks that we can change our masks on a regular basis, because if you don't, then that can cause problems, because you can get a buildup if you were infected inside the mask yourself. So yeah, I think masks are easy. It should be. I mean, they're not fun. Nobody likes them. But as far as preventing spread of the virus, very, very effective.
I've been told by people out there who are anti-maskers, if you want to use that term, that during the Spanish flu, more people died from exposure of wearing masks than not wearing masks. I don't know what statistics and where they get those statistics from. However, my response to them, and you again correct me if I'm wrong, has been back in 1918, we didn't have a lot of this information, that masks being worn day in and day out and not being washed and not being aired out and all of that is going to cause a problem for anybody, healthy or not. It's just a buildup. And now we know better. We have N95s. We have all kinds of masks. The masks range from copper-driven, laced masks. I mean, let's be honest. I mean, you have a mask for everything you can think of, and some are more effective than others. That we understand. Bandanas are not as good as a fitted mask, and N95s is probably the best overall mask. And then we even have masks that our emergency responders use for fire, for other emergencies, not only for transmission of disease, but other harmful chemicals. So there's a lot of masks out there. But I think we agree masks help. I think you said that, masks definitely helps. But also washing, airing it out. Dr. Pang used to always tell me, 12 to 16 hours, leave the mask out, you're good to go. You've killed all the germs. In room temperature, what do you call ambient temperature? I'm just trying to remember all these words. I have so many big words in my brain these days, I'm not sure what word I use.
Yeah.
But anyhow, Dr. Irwin, I didn't mean to ramble on.
No.
But these statements that you hear about these anti-maskers really make no validity to what we're trying to accomplish here.
Yeah, I mean, you can just think about, why do surgeons wear masks in when they're doing operations? They're going to be wearing masks. They're not sick. They're not expecting to be sick, but they know that they can transmit germs from their mouth, to the patient, and so it's an easy way to prevent that from happening. So yeah, the idea that masks aren't effective, or that where somebody I would have asked them, well, please show me the data on that more people died in the 1918 flu from wearing masks than not wearing masks, because I'm certain that's not accurate at all. They didn't even know when that flu outbreak first began. They thought it was bacterial for quite a while because they didn't know that much about viruses yet, and so they were really just figuring it out, what was going on. And so there were some people wearing masks, but a lot of people, the majority, weren't even wearing masks. And remember, this was worldwide also.
Yes.
It actually ended World War I, was that flu.
Yes, yeah, 1918,
Yeah.
because of the outbreak, many countries started to turn their attention and their resources towards protecting their citizenry instead of producing war munitions and all of that. So that was a big part of why the World War I ended.
Yeah, they didn't have enough people to fight either,
Yeah.
because it was actually affecting people that normally flu doesn't affect so much, the people from about 18 to 25, 30 years old,
Yeah.
the soldiers.
So the other question begs to be asked, today science has not only peer review, but we have technologies, oh my God, science today has quantum leaped from just 10 or 15 years ago.
Mm-hmm.
And if you go back to 100 years ago, oh my God,
Mm-hmm.
So we're able today to experiment, to test, to verify in a very quick time frame versus maybe what we could have done even back as late as the 80s and 90s. I'll go just that far back.
Absolutely.
With making sure the affectability, the efficiency rate of all of these vaccines and other medicines we use are there to make sure that you, the patient, you, the person, you, the human being, probably has the best chance of survival. Now, again, nothing's guaranteed, nothing's 100%. And we remember when we started with this vaccine, it first came out, they said 94 to 96% Moderna and Pfizer, and 70-some-odd% with Johnson & Johnson. But Johnson & Johnson was the one and done wonder that everybody felt like a lot of people wanted it because they didn't have time to go back in 30 days or 28 days or whatever, and the clock and all that other stuff. And I had a lot of people just take Johnson & Johnson, but they were just inconvenient, so they was, this is better, boom, and maybe not as effective. So, but you would agree with all the scientific technology that we have today, that we're able to fight and produce and even make vaccines, not in years, but in months like we did.
Yeah, absolutely. No, there's the speed that science can work now, the technology has advanced so much, especially like you said, from 100 years ago. It's exponential where we're at right now, and that has made a big difference. And I think that's something else that people don't realize, like with these mRNA vaccines. When I first heard about this coming out, I was like, oh, thank goodness, finally, because this work hasn't just started. This has been going on for the last 15 or 20 years, and on SARS viruses, other coronaviruses, like the first SARS, and so we're SARS-CoV-2 is this virus, but there was a SARS before that caused a pandemic, but it wasn't so easily transmitted, so it wasn't as, people didn't hear about it as much. But yeah, so people have been working on this for actually a very long time. This isn't new. Mm-hmm. It's just that, it's new to most people hearing about it, but in the scientific world it's not. And the other thing I think about is that, science is luckily it's global. People work together. I talk to people in other countries all the time about things, science related, and the work I'm doing or the work they're doing, and that's the way science works. But this is the first time I've ever been, or since I've been alive, that we've had a global commitment to one problem in science, so that the global scientific community came together, all working on the same thing, and all the communities putting in funds and their resources towards it. So it's not, it's not surprising at all that we could come up with these vaccines in this amount of time. This is.
Dr. Irwin, you brought up a lot of great points, and I want to thank you very, very much.